This morning, I think we're going to talk a little bit about, the additional mounting evidence for some of the non-pharmaceutical that we've been discussing and talking about, and why those are providing protection and ultimately freedom for all of our community. So this is an updated guidance document, scientific brief that the CDC just released this week about the use of face masks and the impact. So 6 months later than we actually needed them. So I guess right on time for the CDC, but we actually have official guidance now talking about the benefit of face masks, including cloth face masks, and preventing community transmission. So I think it's important for people to go read this entire document because not only does it lay out the scientific case very well, but it includes multiple references that one is able to go check with to find where the evidence comes from. But I'll highlight a couple of things where this scientific brief says that multi-layer cloth masks can block 50 to 70% of fine droplets and particles from the wearer. So this is increasingly convincing evidence of what we already suspected very strongly, and it's seen that these cloth masks can prevent shedding from people who are infected. But the CDC also went on to discuss the fact that these masks now clearly have filtering capacity that protects the wearer themselves from being infected. So it talks about 50% of fine particles of less than 1 micron being filtered by these masks. And I know that a lot of people get questions about, well, these masks, their pores aren't small enough to stop viruses. But, again, this goes to describe a little bit of the science behind that. It's, not virus-sized particles that we worry about. It's larger particles, 1 micron, 3, 10, 20 microns. And those are stopped not only by mechanical forces, by significantly by electrostatic forces. And that's one of the more critical filtering mechanisms that the masks have. And there's a lot of evidence that's presented in there to discuss that. So good fodder for pushing back against some of the pseudoscience that's out there. And finally, the guidance looks at community evidence of mask implementation in communities, and shows that across the board, when this has been studied, new infections fall significantly when mask mandates are introduced at a city or a regional level. And it goes on to look at modeling that demonstrates that increasing universal masking by only 15% could reduce the need for lockdowns and reduce associated economic losses of $1 trillion or 5% of gross domestic product. So pretty convincing evidence about the utility and the impact of mask mandates. The second thing I want to talk about just briefly is there was another study that came out looking at household transmission events in Tennessee. And another good article, it's in MMWR. I would recommend everybody go read it. But one thing I thought that was striking was, the high rate of household transmission that was evident in this study, quite a bit higher than was seen in some of the studies from Asia, 50%. But it also shows, as you can see, that incidence of household transmission did not differ with the age of the index case. And so when the index case was a child under the age of 12, the transmission rate continued to be 50%, so just as high as it was in any other group. So again, more evidence showing that children actually are important sources of transmission in the community when we actually look. The third thing I want to discuss is this really good study that was just published in Nature that looked at mobility data from cell phones and overlaid that on case incidence data and then modeled what the interaction between those two things were. And it's a pretty powerful study. So published in Nature, right, the most prestigious journal in the world, from a team from very good academic medical centers. So this is the real deal. And also the data they looked at was incredibly rich. They took cell phone tracking data that exists for 98 million people in the USA in 10 major metropolitan statistical areas. And they basically broke it up then into 57,000 census block groups, or smaller groups of people that they could analyze and looked at 553,000 points of interest. So different venues, locations throughout these cities. And doing that, they were able to analyze 5.5 billion edges, essentially. So interaction between person and place and disease incidents. And what they found is that, again, supporting evidence that we've already seen and is now overwhelming, the disease spreads primarily by super spreader events in points of interest. So 10% of the points of interest that were studied accounted for 85% of the infections. Again, a small number contributing to the largest fraction. And when they analyzed what these points of interest were, the points of interest that had the highest association with transmission were, not surprisingly, full-service restaurants where people are sitting down unmasked, gymnasiums, hotels, cafes, religious organizations, and other restaurants. These were the most important venues for transmission events. And when they analyzed by metro area in Chicago, just looking at full-service restaurants, they estimated that almost 600,000 additional cases were associated with infections from full-service restaurants. Again, triple the risk of any other venue. And you can see this on the graph here, where up on the top right, those venues, full-service restaurants, fitness centers, cafes, and snack bars, hotels, motels, limited service restaurants, and religious organizations, by far the most riskiest places for transmission, and makes a lot of sense. This is where people are congregated together in close proximity for long periods of time and often unmasked, and often doing things like talking loudly, singing, etc. And so we have increasing evidence about how these various non-pharmaceutical interventions reduce transmission, and increasing evidence of the impact of reducing transmission in terms of, in the Chicago area, potentially 600,000 cases that can be attributed to these venues. And that results in thousands, tens of thousands of hospitalizations and tens of thousands of deaths. So while we can talk about these things as being, individual liberties, the reality is none of us are free right now because we are all held hostage by this pandemic. And until we control the pandemic, nobody will ever have liberty or freedom. And I think this is pointed out well by Camus in his writings in the book The Plague. And then finally, I would emphasize the fact that public health laws are well established in precedents and in common law. And it's understood that in some instances, the liberties and freedoms and health and safety of the public outweigh your individual freedoms. Thanks.